We welcome you to day 2 of the Get It Done Week sessions offered in partnership by the Speakeasy Howard and the Horizon Foundation, the Office on Aging and Independence, and the COGS membership group. We welcome you to a series of sessions that we'll have over this week about planning for the future and getting those things done that we all know we need to kind of get checked off our list. So this afternoon, I'm going to introduce 2 guest speakers who will be sharing about housing options as we age. Patty Hutton, who's with the Residency's Advantage Point, and also Emily, I meant to ask you how to pronounce your last name before we got started and I failed to.
LeClaire.
LeClaire, thank you, with the Howard County Office on Aging. So they will be presenting today on today's topic. We had one question in the Q&A, can we see participants? And just to answer you, no, this is a webinar. So participants will not have their videos on, but our panelists will have their videos and their microphones available. We'll say that if you have questions, feel free to put them in the chat or the question and answer box there. We will try to get to them if there is time. With that, I will hand off to Patty. And Patty, please, hopefully your screen share will work and we can get started.
Great. Well, thank you very much. I'm sure my screen share will be working fine. Let's see here. We'll pull it up.
Perfect.
Okay, and you should be able to see the first slide. First, I'd like to thank Speakeasy Howard and the Howard County Office on Aging and Independence for inviting COGS to co-participate in this very important series of webinars to help people get important work done so that they can plan for their future. I am the current vice president of COGS, and I've been with the organization for a little over 2 years now. We're an association of professionals who serve seniors in the Howard County area. So we are a group of professionals who assist in some way older adults in the Howard County region. I'm also the director of marketing for residences at Vantage Point, a life plan or continuing care retirement community here in downtown Columbia. I've been with them for over 2 years, but have been in the senior living marketing and sales and market research field for almost 30 years. So I've got a little bit of experience. Happy that I'm looking forward to sharing with you today. And also I'd like to introduce Emily and let her introduce herself.
Hi, everyone. My name is Emily LeClaire, and I work for the Howard County Office on Aging and Independence. And I work in a department called Maryland Access Point, which we are the information and assistance part of the office. And we are available to help older adults, persons with disabilities, and their caregivers find out what resources or services options might be available. So thank you, Patty.
Great. Well, I'd like to get started and go through the presentation. As Tiffany said, we'll be taking questions as we can. And Emily and I will be passing off the presentation, and we hope that you will be able to get your questions answered at some point today, whether it's now or at the one-on-ones. So I like to start with asking some questions about what to consider when you're thinking about your future throughout your retirement years or your older adult years. Where do you see yourself? Not only in 1 year, as winter's coming, but also where do you see yourself in 2 years? Where would you see yourself, or where would you like to see yourself in 5 years, or 10 years or more? So that's the first question I like to ask someone who's unsure of planning for their future and where they might want to consider, or where the best decision might land them. So the answers are, do you want to live where you live now? Your home is your castle. Do you want to live where your children or your family live? Or do you want to live someplace entirely different? So if that can help give you a direction on where you're looking and where your plans need to start putting you in that direction. I'd like to start with some of the options that are available. And Emily and I have this slide, and I think this is a perfect snapshot for how easy it is to navigate senior living options and care as we get older. It's a bit confusing. and you know, there is no PhD, or there is no education in a formalized classroom that can help you navigate senior living options. It's been in the past for many generations, sort of a learn as you go. So we're very proud of you for all taking the step to learn about this before, hopefully before this becomes an urgent matter for you. So there are a range of choices of living options along the spectrum, and they really depend on where you are in the spectrum of your healthcare needs, as well as the different costs related to them. So of course, staying in your own home is one of the choices for home care, and would be in the least expensive category. But then it also includes the different services that can be brought into the home or available outside the home, such as adult daycare, home health care, independent living communities, senior apartments, retirement communities, continuing care retirement communities, or life plan communities. There's temporary stays for respite care, long-term assisted living care, hospice care, memory care, and then the final highest level with the highest cost in the upper right corner, nursing homes. So it can be a bit confusing or daunting trying to understand where you should be headed. Hopefully we'll give you some clarity today with what we're going to be going through. Generally, when we talk retirement communities, and retirement communities are often lumped under one umbrella, but they're actually separate and distinct, specifically regulated types of housing. One of the least restrictive and the first that people often consider is an active adult community or 55 plus community. These are typically a real estate purchase. They would have homeowners associations managing them, as well as dues associated. They are low maintenance homes. Generally, they the community would take care of the exterior and maintenance, lawn care, etc. They may be condos, townhomes, or single family homes. If you're familiar with Leisure World in this area, that would be an example of a 55 plus active adult community. They usually have some common gathering space, community center, other recreation activities such as pools, golf is common, tennis. But should something happen to you or your spouse health-wise, very often residents would need to move to a different and separate community or separate location. And their management of that health care is strictly done by the family or the spouse. When you move, when you leave, because this is a real estate transaction, your family or you are still responsible for resale of the property. The next type of age-restricted rental housing is available to people 55 and over or people 62 and over. And that's a distinction made based on who the owner-operators or management of the age-restricted or the rental apartments are. Residents are independent. In other words, they are able to care for all of their daily activities on their own. Senior rental apartments can be market rate, They can also be moderately priced and or subsidized. So they have a number of different ways they're paid for. Many also, similar to active adult communities, have common socialization opportunities, community rooms, amenities such as a pool, a gym, computer rooms. Some even have salons or areas for dining. The buildings are accessible with elevators, and some apartments might have additional accessibility features. Independent living retirement communities are a little bit higher level, offer a little bit higher level of service. They're also start at a minimum age, usually that is 60 or 62. They're secured buildings. There are staff members greeting and screening the visitors. They may offer a dining plan. Some offer supportive services like in-home care for additional costs. Some may offer some additional healthcare services with many with amenities, pools, dining rooms, garden areas. The monthly rental fee covers many of those services, while others in the fee-for-service system is used. Some might offer independent and assisted living options. They may have both levels in their buildings. So those are, they seem similar, so it can be difficult to tell them apart often. But many times the big distinction is how they're paid for. Assisted living, that's a very common term. Did you want to add anything, Emily?
No, I wasn't sure if you want me to do this slide or not.
Oh, okay. Yeah, when we go to assisted living, that is a separate and distinct type of housing that we will turn this over to Emily to finish up describing.
All right, so Patty did a great job going over independent type of housing options. And so when it gets to a point where individuals have more needs that their independent options don't offer, assisted living would be the next level of care. So this is a type of housing for those who need variety of different medical and personal care. These are for individuals that need assistance who can no longer live independently, but don't require the 24-hour care that they would receive in a nursing home type of facility. And in these assisted living facilities, they're providing assistance with personal care like bathing, dressing, grooming. They're providing the meals. They will do medication management, and they have staff there available 24 hours a day. So if you needed assistance or you felt sick, you had that support to be able to get. Here in Howard County, I like to break it down to there's going to be larger assisted livings and there's going to be smaller assisted livings, what we call group homes. And on the next slides, we'll go over a little bit about what the differences are. So larger assisted living facilities are generally going to be 17 plus residents. Here in Howard County, we have approximately 12 larger assisted livings. And typically, you're going to find these going to be operated by a corporation, owned and operated. And oftentimes, when you go into these facilities, they're going to have more of a hotel or facility feel. And the pictures on the slides are just stock pictures I found on websites of some of the larger assisted living facilities in our area. Some examples would be like Morningside, Brighton Gardens, Sunrise, Harmony Hall, to give you an idea. Next slide. Smaller assisted livings in our area are going to be 1 through 16 residents. I would say on general, these homes will have about 4 to 8 residents, depending on how large the home is. In Howard County, we have approximately 70 smaller assisted livings. In Howard County, our office, the Office on Aging, monitors those smaller assisted livings. And typically, you're going to find these homes in your neighborhood. You might not even realize it, that you might have a few in your neighborhood that you don't know that is considered an assisted living. And these are generally owned and operated by a single person. I usually say family owned and operated. What people ask me the most is what will assisted living cost and how I will pay for it. So just to give you an idea of the range, assisted living facilities generally will charge a monthly fee, and it can range anywhere from about $2,000 to $6,000 plus a month. And why there's a range is because these fees are generally based on the services and care provided to the resident. So residents who maybe need more help or more care will pay a higher monthly fee, whereas maybe those that just need a little bit of assistance would pay a smaller amount of fee per month. And I like to remind people that these fees will generally or most likely increase as your needs increase over time, because oftentimes we find that people will go into a facility at one fee, and as they're living and enjoying their time in that facility, the fees will oftentimes go up with their needs going up. And they didn't take that into consideration, whether or not that was really a good choice, affordability for them in the long run. So just a good reminder is that these fees will change over time as your needs increase. In our area, the average price for an assisted living is going to be around $4,673. But again, the average range anywhere from $3,000 plus to closer to the $6,000 amount. Some of the larger assisted livings might charge a one-time entry fee. And Medicare doesn't pay for assisted living. I get that question a lot. People will say, well, I want a facility that Medicare will cover. And really, when it comes to paying for assisted living, individuals are going to have to use their monthly income from Social Security, a pension, or fall back on any assets, investments, savings that they have been saving to help pay for their assisted living. And then there are going to be a few state, federal programs that will pay or help pay towards the cost of an assisted living. And you can always call the Office on Aging and Independence, and we can go over those options with you.
Hey, Emily, really quickly, you mentioned Medicare won't pay, but someone asked a question about Medicaid. I know they're different, so just wanted to know.
Yeah, so Medicaid also does not pay for assisted living. Good question. So Medicare, Medicaid are not set up to pay for assisted living. There are just a few different programs that will pay a portion or some of it. And like I said, we can go, those programs will have some type of income or asset guidelines, just so you know. But good question. All right. So that's kind of assisted living really quick. I could do a whole presentation on assisted living, but the next level of care after assisted living would be nursing home level of care. And there's a couple ways people are going into a nursing home. So one is they're going there for long-term care services, where they're going to be offered a place to live, room and board, healthcare services, and then where they're going to be remaining there for their care. Then there are times when people go to a nursing care facility for a short-term reason. Maybe they need to recover after surgery or after a hospital stay, or they need to continue getting rehabilitation services like physical therapy, occupational therapy, or speech. So that's how there's two ways for you to get nursing home care. Either you're going to be there as a long-term care resident because you require a good amount of care, or you're going to go there for a very short period of time to get stronger and to leave and return back to the community. In these facilities, they offer 24-hour hands-on care provided by licensed nurses, and your care is followed by a physician. They can provide extensive chronic care to end-of-life care. And these facilities are licensed by the state and regulated by the federal government. And just to give you an idea that the average cost, if you were to do it by month, for a semi-private room in our area is about $10,281 or plus. And then down here, we just provided you a website, the Medicare.gov website, which is a good way to compare nursing homes in our area. Next slide. So when it comes to nursing homes, one of the ways is Medicare will cover a nursing home stay if you have a skilled reason to be in that facility. So Medicare is going to be more of the payer source when you need to be in that facility for a short period of time. Using that example, you were in the hospital, you had surgery, and you're not ready to return home yet. You need to continue getting rehabilitation services, or you have a skilled nursing need. Medicare would cover you to be in that nursing home for those skilled services. So Medicare can cover up to 100 days in that facility, but you need to meet these criteria. You need to have a skilled reason, whether that skilled reason be a nursing reason like wound care or IV therapy or needing to be monitored by a nurse for various reasons, or you need skilled services like physical, occupational, or speech therapy. It needs to be prescribed by a physician, and you needed to be in that hospital for at least 3 days for that related condition. So that's the criteria that you would need in order for Medicare to pay for a short-term stay in a nursing facility. Medicare will pay up to 100 days, but they only pay 100% the first day through 20th day. And then 21 day to 100 days, they're going to pay like a copay for that. And in 2020, it was $176 a day. But I will say Medicare will only pay for you to be in those facilities as long as you have a skilled reason. So when I say that, just because they'll pay up to 100 days doesn't automatically mean Medicare is going to pay for 100 days. I think sometimes people think, oh, I'll be in there for a while and I got this, Medicare's got it. But that's not necessarily the case. If you no longer have a skilled reason, maybe you no longer need the therapy or you no longer need that skilled service from a nurse, then Medicare's going to say, or the facility's going to say to you, it's time to look at discharging back to the community or back to a different level of care. So I just wanted to clarify what that means by up to 100 days.
Okay, and there was a question that relates to the Medicare and Medicaid payments. Will Medicaid pay for home and community-based care in the small assisted living homes?
So Medicare also has a service that they will cover for, I assume, home health that the person is referring to. So home health is a service where that skilled service could come to your home rather than in a facility in the nursing home. So if you had needed that skilled service, you were in the hospital for those 3 days and your doctor's recommending that skilled service, but you could go back to your home or back to the assisted living, yes, Medicare could cover that home health service for that short period of time. So it's going to be only covering probably the physical therapy, occupational therapy, speech, and depending on the facility, depending on the facility, they might not cover the nursing because you might have nurses in that assisted living, if that makes sense.
And is there any Medicaid assistance for the small assisted living group homes?
Okay, so I'm going to go back. Medicaid does not pay for assisted living. There's going to be other programs that could possibly pay.
Okay.
Yep.
And I'll put a little plug in. We'll show you at the end, because several of these are health insurance type questions as well.
Mm-hmm.
And we'll have a session on health insurance tomorrow that may answer more questions. So, but thank you for getting those. Yep.
Okay.
So generally, if a person requires or needs long-term care services in a nursing home, then medical assistance, Medicaid might be a paying source for that long-term care stay in a nursing facility. So like I mentioned, the average cost of a nursing home stay for a month is going to be $10,000 or plus a month. And most individuals just don't have that type of income from their pension or Social Security that can cover $10,000 a month. So then we look at assisted medical assistance. And so medical assistance has two parts. Medical assistance has a coverage part for those in the community that have limited income and they provide health insurance. But then medical assistance has a part for paying for a long-term care stay in a nursing home. I'm not going to go into too much details about this, but we wanted you to know about medical assistance and paying for a long-term care in a nursing facility. In order for medical assistance to be the program that pays for it, there's a little bit of criteria. One is they need to meet the medical criteria, meaning that that the person needs to be nursing home appropriate. They need to be in that nursing home. The state or the government doesn't want to pay for individuals who don't require a nursing home stay. So if your needs could be better served back in the community or in an assisted living, then that would be something that you would want to look at. But if you need a nursing home level of care and you meet that criteria, then you've met that criteria. The other criteria is that your income cannot pay for the monthly fee in a nursing facility, and your assets have to be down to less than $2,500. So yes, you're going to have to go through your assets in order to qualify for medical assistance to pay for the nursing home. The other thing I get questions about is people want to pay for long-term or want to apply for long-term care medical assistance in advance before they or their loved one are in a nursing home. And unfortunately, you can't apply for it in advance. You have to be a nursing home resident, and if you meet that criteria of medical and your financial criteria, then yes, you will be encouraged to apply for long-term care medical assistance, Medicaid, to help pay for your nursing home stay.
Thank you, Emily. Let's see. Thank you very much. So very good explanation and touching on some of the important points of the healthcare related retirement living options. And I'd like to wrap up, talk a little bit about a life plan community or continuing care retirement community, which is a type of community that provides residential living opportunities as well as the community amenities portion with guaranteed access through what's called a residency agreement to their on-site continuum of care settings, which would include assisted living services, possibly even specialized memory support, as well as the long-term and skilled nursing needs of residents as their care needs may increase or as they may need a temporary rehabilitative stay. So you're provided, whether it's all under one roof in a single building, the full continuum, or whether it would be in maybe adjoining or separate buildings, but all on the same campus under the same management. That is what is called a continuing care retirement community. We talk about the residency agreements, want to cover some of the basics because once you've visited one life plan community, you've visited one life plan community. There's no set standard for one type of community covers every, or one type of agreement doesn't necessarily cover every type of community. So there's generally an upfront fee based upon the agreement type, as well as the size and style of the independent living residence that you're moving into. There's, in addition to the entrance fee, a monthly fee that would again be based on the size of the residence and what is included in the residency agreement. But these are very service-enriched lifestyles where those fees would include typically property taxes, some housekeeping, a dining program, your utilities would be included, groundskeeping, snow removal would be included, amenities such as the fitness centers and other activities are included, utilities, 24-hour call services, as well as repair and replacement of many of the major components that if you're in your own home, you would be responsible for. So what you're looking at when you consider a life plan community is generally the amount and duration of the long-term care programs that are covered under each agreement. The first one is a life care or type A contract, and that can often be compared somewhat to long-term care insurance in that it gives you a way to project your monthly costs into the future because your fees remain virtually the same throughout the continuum. This model does have some tax benefits that, as it's currently considered a prepaid medical expense. It's also often comparatively the most expensive type of agreement. A type B is a bit modified in that the fee you pay in independent living would include a number of free days or a discounted rate if you moved into the assisted living or nursing programs. A type C is referred to as fee for service, whereby the independent living fees, monthly and upfront fees, are lower relative to the type A and type B contracts. However, should you access the long-term and skilled nursing care services, they're paid for at the then current market rates. Or as Emily was referencing in this area, approximately it would go to about that $10,000 a month rate should you need nursing care. Some life plan communities offer a rental agreement where there's very little upfront entrance fee or no upfront entrance fee, simply a month-to-month lease, but they do have all of that long-term care component, but that would also be at that fee-for-service current market rate paid for when you use it fee. A type E, there is an equity option among life plan communities where there is an ownership fee simple purchase component. It does have the monthly fee for the services that would be part of the program. And typically the healthcare is paid for on an as used fee for service basis. And again, as with the other 55 plus fee simple living styles, the owner responsibilities remain the same so that when you vacate that residence, you or your family is responsible for any of the resale. How do the entrance fees work? This is a big question that we often get because originally when continuing care retirement communities were founded, many communities simply asked for somebody moving in to give the community all of their assets to be taken care of for the rest of their lives. Life care communities is what they were referred to. Over time, we've graduated to follow what consumer preferences are and meet consumer demands. So there's generally an upfront fee, and there's two main choices. One is a traditional declining refund, which is what you paid would be returned to you when you left the community on a declining basis, generally over a period of 50 months is the most common time frame that you'll find. Relative to other guaranteed minimum return options, the declining refund options tend to be the lower of the costs. There are many options when you look at the guaranteed returns minimums on entrance fees, and this varies widely from community to community. And some communities offer more than one refund plan, but you're guaranteed a specific amount of your refund regardless of how long you live at the community. And most common refund amounts you'll see when you compare would be 50% refundable, 90% refundable, and there's across the country a scattering of 100% refundable entrance fees that are you'll still find in different places. But as you might imagine, typically a premium is paid to guarantee that that initial investment refund is available to you. And most refunds are paid based on what you paid at move-in. And again, monthly fees would vary depending upon both the agreement type and how much healthcare is included, and also the refund option you selected. So it gets a little complicated when you start looking at that, because everyone's a little bit different, and it's good to talk to people at the communities to help figure out which one might be better for you, and certainly to consult family or other advisors in that decision. Emily went through some of the costs for the assisted living and the nursing, and I'll speak generally from the Howard County area, what you might find when you compare the different retirement communities in this area. But entrance fees would range from around $100,000 to in excess of $1 million. So you can see there's quite a range. So there's some that are much more affordable to members of the area, and some that certainly are more financially restrictive. Monthly fees range from around an $1,800 starting point to in excess of $8,000. Again, the variation in that range can be dependent upon the size of the apartments, whether it's maybe a studio size apartment to a 3-bedroom home, to whether it's a fee for service type C agreement to a full life care agreement. So those fees give you an example of the value. Medicare does not pay for any independent living in a continuing care retirement community. Residents are paying privately. There may be additional ancillary costs depending on your agreement. Some may charge additionally for housekeeping services or parking services, and certainly some additional in-home care services may be additional costs. Long-term care insurance policies are often accepted in the healthcare centers. And depending on the specific community, some communities do participate in Medicare and or Medicaid programs in their long and short-term, their skilled nursing home sections. So again, they're very individual to the community. And these are some of the pieces of information you'll want to find out for yourself if you're considering this style of retirement living for yourself. We wanted to leave a little bit of time for some additional questions.
Thanks. We did have one question that came in a few slides ago, which was our hospital. I think Emily, you mentioned kind of a required 3-day stay. And one of the questions I'm assuming is COVID related. Is our hospitals cutting back on admitting patients for that required 3-day stay? You're muted, just so you know, Emily.
Good question. I don't work for the hospital, so I can't speak on their policies. I just wanted to make it known that you do need to have that 3-day hospital stay as a requirement in order for Medicare to pay for a rehab stay or even to qualify for the home health benefits. Because I do get calls from family members who oftentimes thought their loved one was admitted to the to the hospital, and only to find out they were considered observation or on the observation unit. So these are excellent questions when you are at the hospital, to ask, are you admitted? Are you considered a patient of the hospital, to get clarification, because that will help you and your family know what maybe options might be available upon discharge. And I always say discharge starts at day 1. So it's because it can happen really quickly. So just be mindful about that.
Great. I saw someone raise their hand. Again, because this is set up as a webinar, we'll need you to type in those questions. That'd be great. See one here. For those of us living independently, we need to plan in advance of a hospital stay. So I guess just a comment there. I think everyone would echo that. Another question, what is the typical tax deductibility of a type A plan? Boy, oh boy, that might be a health insurance question, but I'll let you all.
A financial advisor or tax accountant really would be the expert that you would want to refer to for yourself. However, and it varies from year to year, from community to community, because the IRS calculates the total community's cost of care and then calculates that based on the number of residents and the utilization. However, I can tell you from my years of experience that it's generally approximately 30% of the monthly fees that are paid that year. And then in the first year of occupancy, the year you move in and pay the entrance fee, you can also take a portion of the non-refundable portion of the entrance fee for part of a tax deduction as your medical expense tax deduction. Now that I'll qualify some of this and give the disclaimer that the IRS may or may not change that rule in the future. Currently, it is still available as a deduction for residents in CCRCs that offer a type A residency agreement.
Great, thank you. So with that, I'm actually going to share the screen to show participants what else is available this week. Let me make sure I'm sharing the right screen here, because we did have a financial planning session on Monday, and we will actually be sharing that with everyone. But also tomorrow, as I've mentioned a few times, we will have our health insurance session. We'll have the webinar as well as opportunity to ask one-on-one questions. On Thursday, we'll have an overview of advanced care planning. Again, the opportunity to get some one-on-one help with an advance directive or a MOLST or a healthcare agent form. The afternoon on Thursday, we'll have a webinar on conflict resolution and then opportunity for one-on-one. And then finally, all day Friday is devoted to the topic of wills, trusts, and powers of attorney. We know a lot of folks have questions on that. So for right now, I want to thank Patty and Emily, and also head back up here. You can get this website at the speakeasyhoward.org, our main page, the Get It Done page here. So speakeasyhoward.org/getitdone. Emily and Patty are available for the remainder of the day for one-on-one appointments. So if you go to that website and you click here for sign up for virtual one-on-one help, you'll see that there is quite a few spots left with Emily and with Patty this afternoon. So if you do have individual questions, you want to dig more into these topics, feel free to register and they'll be able to get on the phone with you sometime later today. So we encourage you to take advantage of that. So Emily, Patty, any last words or things you'd like to share?
Well, thank you all for joining us. I commend you for wanting to learn about all of your options and educating yourself. As we saw in that one slide, this is not an easy path to discern for yourself. So it's always advisable to get an advanced education, not learn while you're doing, and also get to the right experts.
Yeah, Great. Well, thanks you both and have a great day, everyone. Thank you.
Great. Thank
Bye.
you.
Bye-bye.